Hi, good morning. We're just waiting for a few more learners to join, but I can see just Jesse and Cam, which have joined so far. So just give it 1 or 2 more minutes and we'll make a start.
Hey, good morning.
Good morning. Morning. Right, so we'll make a start. For those of you who've joined on time, thank you so much for joining and your patience in terms of, obviously just making sure that because it's a new unit, I want to make sure that most of learners are able to join and obviously take advantage of the live session. Now, what you see on your screen right now is primarily a unit spec for the unit that we're going to be starting. And this particular unit essentially is the unit which, it talks about structure and overview of the health and social care sector. Now, this particular unit is the starting unit in this particular qualification, which is level 3 diploma in health and social care, and is predominantly based on you developing a lot of understanding in terms of how the national health services within a particular country work. So for the purposes of this particular unit, we'll be focused on, the NHS or National Health Services within England in particular. Most of my examples and the details that I will share with you will primarily go on to covering the NHS and NHS-related services or the services it provides to the members of public. Now, the main aim of this particular unit is primarily to help you develop a bit of an understanding of the health and social care sector. For those of you who are new and are looking at making a career in this particular sector, I think it will be important for you to understand this unit in a great more detail, simply because it'll give you, for some of us, it could be back to school, but for some of us, it could be giving us a lot of information with regards to understanding the history and background of how the NHS and the national services were actually set up in the UK post World War II. Now, obviously, UK is a welfare state, and when we say we are a welfare state, the Beveridge report, which was initially published in the 1950s, basically proposed to the government that if UK was to call itself a welfare state, there are certain services which need to be given absolutely free of cost to the members of public. They included education, housing, medical services, and schooling. So apart from that, there are a lot of other host of other services which constitute the fifth arm, and these five services in particular make UK very different from any other country in the world. And that is why we say we are a welfare state. Now, when we look at covering this unit, there'll be a bit of going back into a bit of a background in terms of understanding what is health service and how does, in general, the healthcare sector work within the UK. Now, a couple of things before I start the session, and these are housekeeping tips. Essentially, I would want you to follow is that if you are essentially not asking any questions, please make sure that your mics are muted, because a copy of this recording would then be also made available to some of the learners. And obviously, what we do want is no verbatim in the background to be, heard at any given point in time. If you were to look at watching a recording. The other bits would be that feel free to ask me questions at any given point in time, and these questions can be asked either through the chat route, or you can essentially, stop me and obviously ask me a question at any given point in time. Now, the other bit which I would do is before I start the unit, in my case, what I end up doing is essentially ensuring that, we look at the unit as a whole. That means we look at the unit in terms of its introduction, what we are expected to cover. We also look at the assignment brief, and we also look at how this unit is going to be taught and delivered in terms of the sessions that I'm going to do. So first and foremost, what I'll do is I'll take you through the unit spec, which is what you see on your screen right now. And this particular unit is a part of a graded qualification. So for those of you who are achieving a pass, you'll multiply credits, which is 12 for this unit, by 3. That means you'll end up getting 36 points towards the overall grading system. And for those of you who are looking at achieving merit, it'll be multiplied by 4. That means you'll be able to get 48 points with this unit. And for those of you who are looking at distinction, because this is 12 credits, distinction has a multiplication factor of 5. And when you multiply 12 times 5, it'll be 60 points that you'll be able to get. So keep that in mind, that this is a high credit unit in the qualification 6 units that I'm assuming that, for some of you, in terms of, grading, overall grading, because it's difficult sometimes to score a distinction or a merit in all the units. But assuming if you're looking at keeping your overall score on merit or distinction, then it is vital for you to score good in this particular unit, because this carries 12 credits. Now, this unit has 4 learning outcomes. As you would see, you have learning outcome 1, 2, 3, and 4, and there are various assessment criteria in learning outcome 1. So there are 4 pass criteria, 1 merit and 1 distinction. Generally, give or take, in any unit that you would study, you normally have about 3 or 4 merit criteria in addition to the pass criteria if you want to look at achieving merit, and distinction criteria tend to be 2 or 3. So opportunities in terms of achieving a higher grade would mean that you would need to get a minimum pass in this unit, which means you attempt all the assessment criteria which are given across the 4 learning outcomes and pass. But if you're looking at achieving a merit, then you have to do pass plus the merits. And if you're looking at achieving distinction, you have to do everything in terms of making sure all the assessment criteria are addressed. Now, so in this particular unit, we're going to be looking at 5 sessions, or probably 6 sessions. The reason I say that is because we'll cover 1 learning outcome in 1 session. But apart from that, towards the end, we'll also look at an assignment discussion session, and that'll give you a bit of an idea in terms of how you need to go about doing the assignment. Now, there is a lot of indicative content which is obviously used to create presentations. So learning outcome 1 will have this in the slides. Learning outcome 2 will have this in the slides, and so on and so forth. Now, sometimes if the learning outcome is, the content given in the learning outcome is a bit brief, we would obviously improvise and add content to it, which would mean that you are able to get a thorough knowledge as far as the unit is concerned. Now, very briefly, let's look at the assignment brief as well for this particular unit. Not something that you need to be worried about right now, but what I want to do is get this into a bit of a context so that we are aware what are we looking at attempting when we do talk about the assignment brief. So here, when I show you the assignment brief, what we are looking at essentially is the assignment that you would need to attempt in order to get the grading in the unit. Now, this is the assignment brief. Mostly in all the assignment briefs, you would see a bit of a background given by ATHE, which will say that this is what the assignment will cover. But essentially, what you have to keep in mind is that the assignment is going to measure or is going to be an output which will actually measure the understanding of what understanding you've gained in this particular unit. So when I look at the assignment brief, I have to look at it objectively. I have to understand what the assignment is asking me to do, what evidence is being asked from me to be compiled, and you need to follow that particular evidence and follow the assignment brief and create that particular evidence as per the directions given. The reason I say this is in most cases, when you look at ATHE assignments in the health and social care course, they will always be asking for two types of output. One, the idea is we don't want you to produce pages and pages of assignment. We don't want you to write a thesis. Your assignment should not be more than, I would say, or should not be exceeding more than 5,500 words. This is a habit that you have to get into, primarily because of the fact that when you go to universities, what you're going to be able to see is that there is a word limit on the assignment. And when we do talk about word limit on the assignment, what essentially you would see is that you're going to be penalized for writing more in terms of words for the assignment. So generally, university assignments, if you're looking at progressing to university, which I think most of you are, would be that the assignment tends to be between 3,500 to 4,000 words. Anything plus minus 10% is tolerable, but anything more than 3,500 words, would be penalized. Because, let's look at it this way. If I'm a lecturer, I have one barometer or one scale against which I will mention and, give a task out to every student, and then I will measure that particular task based on that particular scale. I can't say that, okay, she's my favorite or you are my favorite, and I'll allow you to write more words. Because if I allow you to articulate and write your assignment in more words, then it gives you an unfair advantage to be able to bring the evidence across in a much better form. So that is where I think a lot of you who have been submitting assignments and I've been marking some of them, what I do tend to see is that the assignment tend to be 10, 15, 16,000 words. You need to get into a habit of referencing your work. You need to get into a habit of essentially using in-text referencing and using arguments to build, I would say, propositions when you are presenting evidence. So you have to also keep in mind that when I look at the assignment brief, if you look at task 1 for this particular assignment brief, it says prepare a set of presentation slides. So presentation slides would cover some of these assessment criteria, and there will be some speaker notes that you will create, but those speaker notes can be written under the slides, or you can submit that separately as a document, which will say slide 1, and you're explaining some of the points in 50 to 70 words maximum, and slide 2 and things, and so on and so forth. But I would not be accepting this assignment if the task 1 is not produced as a presentation, because it is very clearly asking for you to develop a presentation slide which will cover some of these assessment criteria which are given together here as bullet points. And for merit and distinction, always in the assignment brief, they are labeled as what are called extension activities. And it is not difficult, and again, I would not say it's common sense, but what I would point out is that when you look at the bullet points here and you look at the learning outcome and the assessment criteria it collates or, refers to, they would exactly match. So if you look at learning outcome 1.1, the first bullet point is 1.1, second is 1.2, third is 1.3, 4 is 1.4, and that covers the 4 pass criteria. And when you look at extension activities, this is 1M1 and this is 1M2. Oh, sorry, 1D2, 1D1, which is the distinction criteria. Now, in task 2, it is saying prepare a timeline or a table. So you're going to be using a Word document, create a table in that, and that would essentially depict a timeline. You cannot descriptively, describe it, because at the end of the day, the output in the assignment is asking you to prepare a table or a timeline. I will go into details of this discussion in the assignment discussion session, but just very subtly pointing this out that when you do get into the assignment brief, at some stage when we've covered the unit, the idea would be to read the assignment brief once, at least, without even starting the assignment. Understand what is the output being asked for, what assessment criteria are being addressed, and how would you go about collating the evidence to do the assignment. That is the first thing that we do. So planning part of it is important. And again, when I go into task 3, it says prepare a handout. Now, handout is going to be a Word document. Even a timeline or a table would be presented as a Word document, because you'll use a Word document, insert a table, and obviously then create a timeline by inserting 3 columns. So one will be description, middle will be the one in which you're writing most of the description, and on the right-hand side is where you would probably put year or some sort of a timeline. Now, these are some ideas that I'm sharing so that you're aware that the unit that we're going to study, it's going to ask you to create a varied form of evidence. The idea here is not to make it taxing on students to be able to produce pages and pages of evidence, but the idea is to help you develop soft skills, but also to test your knowledge by asking you to produce different forms of evidence. This is called different types of assessments. So there are 16 different types. But generally, in this course at level 3, you'd normally see 2 different types, because what I'm saying when I say 2 different types, I'm actually classifying it on the basis of the output that you would need to produce. So I'll use a PowerPoint presentation and I'll use a Word document, and that is why I say 2 types. But if I go into the types of assessment, this is a timeline, this is going to be a handout, sometimes it could be an essay, it could be a case study, this is a presentation here. And you could be asked to write a reflective essay as well, and that is where the types of assessments come in. Now, obviously, the last task in this is talking about preparing detailed notes on the basis of discussion. This is to give you a context, but again, it's going to be a document, and that would mean that you will be addressing these assessment criteria along with the merit criteria, and that would allow you to then completely meet the evidence and the assignment. So when you do submit this back to me for the purposes of assessment, I would expect that there's a PowerPoint presentation coming, which could be 10 to 15 slides, 15 to 20 slides. There is some speaker notes at the bottom of each slide, because when you make slides, you put maybe 4 or 5 bullet points, about 30 words on a slide. Any type of explanation that you do could be done under the slide as speaker notes. And then the second form of evidence, which will come as an attachment, will be a Word document. Now, some of you understand this quite well because it's not the first course you're doing or the first assignment. And I've given feedback to most of you who are on this course. Some of the new ones have received feedback but haven't spoken to me either on one of the sessions or on the phone. But what you're generally going to do is obviously submit all the assignments, not as PDFs. It'll always be a Word document and a PowerPoint presentation, not a PowerPoint viewer as file, a PowerPoint presentation file, so that we are able to do annotation on those files by putting comments or opening review. And that is why it is important that when you do submit your assignments, they are submitted as Word documents or PowerPoint presentations, not PowerPoint viewers. So generally, you would see that if there are 4 tasks or 4 learning outcomes in the assignment, in the unit specification, there'll be 4 tasks normally in the assignment. And these assignments do not give any word limit. But generally speaking, from a point of view of teaching and learning, take it from me, who's got 4 master's degree. I've got a master's in law, master's in health and social care management. I have a master's in computer engineering. I have a master's in strategic management and leadership. I have an MBA. So please take it from the horse's mouth that writing more words sometimes also invites more plagiarism and similarity. So try and stick to a guideline wherein your assignment should not be exceeding, more than, I would say, 5,500, 6,000 words at the maximum. That should be alarm bells ringing at your end to say that, the assignment that I'm writing or the evidence that I'm compiling is too much. And that is where I would suggest that you would need to start, paraphrasing, building arguments, writing or doing in-text referencing. And that would essentially allow you to bring the work into some sort of a manageable criteria, and thereby allowing you to develop a skill which is called academic writing. And that skill in terms of academic writing would be very, very useful. Take it from me when you start, writing assignments at the university. Now, In order to discuss the first learning outcome, we'll start off with a few presentation slides that I've created, and we will go through some of these slides to cover some of the assessment criteria in terms of what this unit would essentially be looking at. Now, as I mentioned earlier, before I get into the unit and the presentation and the discussion, any questions that you have which are popping in your mind at this moment, feel free to ask me now. Any questions at this moment? You can unmute your microphone and ask me any questions if you have, and we will answer them as we go along. Now, the main aim of this unit that you're looking at is to understand the health and social care sector. One of the key things that you look at when you look at the health and social care sector is that you need to know a particular, I would say, have an organogram. Just like you have an organization, what we want to be able to do is also see an organogram, which is primarily, a structure of how this particular sector works in the UK. Now, it says a chosen country. One of the things which I would also clearly point out is that some of you are clearly using softwares to write the assignments. I'm happy for you to use ChatGPT and some of the other AI softwares to create a draft for yourself. But that draft would need to be paraphrased, would need to be, referenced, and a minimum of 10 to 15 references are expected at the end of the assignment in order to show, that this is the work that you have brought in terms of evidence, and these are the sources from which the work has been taken. Now, there are lots of softwares out in the market, and I can clearly see that when people bring out Australia, Canada, or US, or some of the other countries, I don't think any of my team or within the lecturing team, they have used any other country apart from the UK. And within the UK also, because we are United Kingdom, we are only talking in specific to being in England in most cases, not even England and Wales. But when you look at NHS and the devolved budgeting, which is in the NHS, it is England and Wales. You have Scotland, which is separate, and you have Northern Ireland, which is separate. So most of the examples and context that I would use or the other lecturers would tend to use in their discussions with you during Zoom sessions is going to be specific to England. So when I see assignments wherein it is going to come across with US examples or Canadian examples or Australian healthcare system examples, unless you've lived there, you have prior knowledge, or you've done your research, please mention that in the introduction of the assignment. Put an introduction down saying that I moved from Australia to the UK, or I've been living in Canada for a couple of years, and that's why I'm using Canadian, for example, healthcare system in this particular unit. There is no way that I would know, and when we do mark, it'll be seen as a sign of plagiarism. Now, for the context of this unit, which is structure and overview of health and social care sector, we are looking at the chosen country as England. And what we are going to be doing is primarily discussing issues which are related to the health and social care sector as far as England is concerned. Now, one of the things that I would show you, as a part of this structure is that the last reform, when it happened in 2012 in the NHS, when the NHS Act in 2010 was passed, what you would generally see is that this is the structure of the Health and Social Care Department or the Department of Health. We have a health secretary. Anybody who knows who's the current health secretary in the UK? Any ideas? Okay, you and I have to Google that up, to be honest, because I've lost track of it. The West Streeting is the health secretary, so he's the head of the Department of Health. And when we look at the outer circle, the Secretary of State, which is responsible for making sure that all the services related to healthcare, mental health care, or any other services related to clinical services, hospital services, A&E services. When we look at the Department of Health, he's the Secretary of State, and he's West Streeting. Now, under the Department of Health, obviously any acts which are passed specifically, we have the Health and Social Care Act of 2012, we have the Safeguarding Act, lots of different types of acts. All these acts are passed in Parliament. And then once these acts are passed, you generally see the Department of Health creates what are called variations or interpretations of these acts, which are then implemented across various organizations which serve under the National Health Service. Now, National Health Service provides services to the member of public. It's a private-public partnership. There are lots and lots of organizations which work in partnership with the NHS. And a few such organizations that you would have heard about could be Bupa, for example, some of the cancer charities like Christie, and they get funding from the government, Department of Health, and obviously they carry out a lot of research activities, which are essentially funded, some part of it by the government, and some they obviously try and fund privately. Now, there are lots and lots of different bodies which make up and represent the Department of Health. For example, I don't know how many of you have you heard about NICE, NICE, National Institute of Care and Excellence, or MHIR, which is the Medical Health Agency, which approves all the medication which is introduced in the NHS. For example, the COVID vaccine, when Pfizer introduced it, it went, or AstraZeneca or some Johnson and Johnson, a lot of this vaccination, which was approved to be given to the members of public, were actually approved first by the medical agency, which is called the MHIR. And this agency, just like the FDA, Food and Drug Agency in the US, approves all the medication, in the NHS before it is, prescribed or is made available to the, patients in the UK. Now, there are lots and lots of agencies. Some of them are charities. You look at the Health Foundation in particular. You look at the King's Fund. These agencies are responsible. You have the CQC, Care Quality Commission. The reason I'm putting a bit of focus on this is that these are words that you would have heard about in studying some of the other units in this particular course. And some of these agencies are important because they help in creation of what are called policies and procedures, which are then implemented within the NHS. And then when we look at people in communities essentially receiving these services, they receive them from different outlets. So you go to a GP surgery, you go to and utilize the ambulance and emergency services. You look at community care centers. You sometimes also go across to a dentist. You go to a hospital. You get healthcare workers coming into home to help the elderly. You have adult health care, which is provided, healthcare services, which are provided, old age homes. So all these policies, procedures, essentially are created by some of these agencies, and controlled by the NHS, and that is what you get to see in the rings which are created in this particular structure. So the outer ring is the government, which is the Parliament creating the Act, the Secretary of the State, Department of Health, which is responsible for running, budgeting, proportioning the budgets, and obviously providing the budgets for different services. You have other government departments with which the healthcare department works. And then in the inner circle, you have monitoring agencies like the CQC. You have the medication or healthcare products agency, which is MHRA, as I mentioned. You have professional regulators, which are basically the NHS Act of 2010. You have various trusts and foundations, which are the PCC Trust, which form up different, which are, say, for example, different forms of trusts, which basically form hospitals and different forms of services. So if I look at Manchester in particular, Manchester Infirmary and the Wythenshawe Hospital is under one trust. You have the Greater Manchester, Northern, Bury and Bolton, they are under one particular trust, and they are then regulated through professional bodies so that these services, these hospitals and facilities provide do not deteriorate. Then you have the Healthcare Authority, you have the PHA, which is one of the public agencies, public health agency. They are all in the first circle. Then you look at the various NHS trusts or national organizations. You have NHS Scotland, you have NHS Wales, NHS England, you have NHS Northern Ireland, you have Public Health England, which is basically the organization which basically sends out all the marketing and messaging related to public. They are in the inner circle. Then you go across to what are called, local organizations, or CCGs, as we call them. We call the clinical commissioning groups. These groups are NHR and NIHR, for example, National Institute of Clinical and Research Studies, and some of the other agencies which are involved in training, education of the staff within the NHS. They form the third circle. After that, you have the core services, which gets funding from all these agencies, policies, procedures, acts, legislation, all are enacted. And obviously, these are the local agencies which we get in touch with when we need any sort of medical services. So this is an overview of, or a chart, or an organogram, whichever way you call it, of the health and social care department in the UK. And this is something we are going to be studying in terms of glimpses of it or parts of it in this particular unit when we talk about the structure and overview of health and social care sector. So the Department of Health essentially forms the health and social care system in the UK. And that is where this is important for you to put it into context. And this is what we're going to be studying when we talk about this particular unit. Now, what if I go into a bit more detail and filter it down, because this could be a big unit which could consume a lot of time in terms of going through lots of things. So what we're going to do is focus on primarily studying what is given in the indicative content of this unit and what is it that we want to cover in learning outcome 1. Now, one of the main things and the question which should come to your mind when you look at the chart which I showed you, or the organogram, is that what kind of services does the National Health Service or the Department of Health provides? So there are 3 types of services that you get from Department of Health, which basically forms the National Health Service. So one, you get primary care, second, you get secondary care, and then you get tertiary care. So if I look at primary care, this is the first point of contact, which could be GP surgeries, pharmacists, or pharmacies in particular, community centers, that we go across to in order to get advice or be able to get, say, for example, get the basic service that we need. Say, for example, I'm running fever for the last 3 days and the fever isn't going away. I've taken a bit of cocotamol or paracetamol and that's not going away. What I would then need to do is go into my GP, which is a surgery that I'm registered with in my area where I live. And that GP surgery, and when I see my GP or the doctor, essentially he or she would diagnose what am I suffering with. Is it some sort of a viral fever or some sort of a in the summer, say for example, if we get hay fever and things like that, the idea is that that would be the first line of support that I will go in and see. Now, if your condition is not very serious, you might also be seen by a practicing nurse or a clinical nurse in the surgery, and she would basically look at some of your symptoms like your blood pressure. Say, for example, if you're coughing and you're having other symptoms apart from fever, then you might be asked to do bloods. And the results of them, when they come out, then the clinical nurse might also see you. And in some cases, the GP will see you and prescribe you medication. When you look at primary care, there are 3 areas or outlets that I generally go across to. Either it's the GP in particular. I go across to the dentist once in a quarter. And then sometimes if I need a medication or over-the-counter medication, which does not need a prescription, then in this case, I can go across to my nearest pharmacist as well and obviously ask for medication. Now, that would constitute what is called primary care. Now, the National Health Service in England provides this care free of charge. Obviously, for some of us, we have to pay prescription charges when you get a prescription from the GP. But this is almost 56.4 million people, or in terms of population in England. When we look at Wales, it's about 3.5, 4 million. Scotland, about 5.5 million, and Northern Ireland, 1.8 million. So that makes up the constitution of 65 million odd, 65 to 68 odd million population in the UK as per the last census. Now, secondary care is sometimes also referred to as when you get hospital and community care. Now, if you need a treatment, or for example, you've had an accident and you would obviously then get in touch with accident and emergencies, and you would require immediate treatment. That would not be offered by first responders or primary care, which is your GP, surgery, dentist, or pharmacist. You would need to go across to specialist hospital or some sort of a hospital wherein you will have people who would be treating you because you need immediate care. And in such cases, that would be provided through hospitals, which are present in most cities. And those hospitals are also supported by accident and emergencies as a department, wherein if people need to be taken across to the hospital, then the A&E tends to be the first responders. They come and see you at your house or at your residence or at your workplace. If you say, for example, if you're having a chest pain, you would immediately need to go across to A&E. And obviously, in such cases, that will be provided through hospitals. Hospitals have the A&E department in them, and that will constitute secondary care. Tertiary care would be once you've had a clinical operation or you've had a surgery and then you are released, you would need some support for a couple of weeks or days or weeks or months in order for you to get back onto your feet. And in some cases, tertiary care is provided, which is basically highly specialized treatment. And in such cases, this tertiary care could be post-clinical, support that you need. And in some cases, it could be a combination of secondary and tertiary care wherein you need specialized treatment. For example, in the case of cancer or recovery, when you're recovering from a particular operation or a clinical procedure, then in such cases, it would include tertiary care. Now, mental health services, which is a separate budget now under the National Health Service, is also covered under what is called tertiary care. Now, if you have mental health issues or issues in terms of OCD, for example, one of the disorders, or ADHD, these are now considered as what are called mental health disorders. And in such cases, you need prolonged care, you need specialist care, and this specialist care and treatment, which is provided by a range of professionals, would constitute what is called tertiary care. So if somebody was to ask you a question that what kind of services do you get from the health and social care sector in the UK, specifically when I say UK, because these three types are available across Northern Ireland, Scotland, England, and Wales, would be primary care, secondary care, and tertiary care. Is that clear? Any questions on this so far?
No questions, thank you.
Good stuff. Now let's go across to some of the assessment criteria, because what we are looking at in this case is to understand what is the structure of health and social care sector in the UK. And then what we are looking at is the types of care and what are the various organizations which are involved in providing this care at the national level, at the regional level, and at the local level. Now, as I mentioned to you earlier, when we do talk about the care that is provided under the national service to members of public, we are looking at private public partnership, and there are lots and lots of organizations which work in partnership with the NHS or National Health Service. Some of them also derive funding or get funding from the government to offer some of these let's say services to the members of public. In such cases, you would generally see that they would also be working very closely with the National Health Service. One such last example that I can put out is that if you look at the breast implants, PIPs, which were put, and a lot of patients had that implants done through a French agency, and obviously now they've been fined. But because there's a waiting list of 40,000, patients which need those implants to be removed because it can lead to cancer, NHS in some cases has allowed those patients which are on the waiting list to get this treatment done privately. And in such cases, that treatment could be done privately within the UK with various other organizations which work in partnership with the NHS, and in some cases even outside the UK. And all the charges and fee structure and other bits of it is paid for by the NHS, because in order to get rid of and quickly ensure that people do not develop cancer and they are able to get these PIP implants removed, it needs to be done in a shortest possible period of time. And that is where the public-private partnership comes in. Now, when I do talk about, the reason I give you the example is when we say healthcare provision also looks at public-private partnership. Now, healthcare provision actually comprises of two types of services. One is inpatient and the other is outpatient services. This is when you look at hospitals and when you look at, for example, community care or tertiary care. You also have rehabilitation, you have nursing services, prescribed medication, remedies, medical aids, and other bits. Now, all these are a part of healthcare provision. A simple example that I would give you is of a hearing aid. Now, if you're over the age of 60 and if you have retired a couple of years earlier, you would be not required to pay any prescription charges. And in some cases, some of the services that you need in order for you to sustain your day-to-day life or your routine would be also paid for by the NHS. So in such cases, when we look at our elderly and if they are retired and obviously, they have, for example, met that particular criteria of being eligible for free medical aid, then in such cases, say, for example, a hearing aid, which is provided to them, will be costed and obviously paid for by the NHS. It will be absolutely free to the patient. So when we look at healthcare provision, and going a bit deeper from when we talk about primary, secondary, and tertiary care, if we look at what kind of further detailing in terms of services are offered under the healthcare, department, or under primary, secondary, and tertiary care, we will go into details like inpatient care, outpatient care, rehabilitation, nursing services, prescribed medication, remedies, remedies could be, say, for example, you need physiotherapy sessions. If you've had a cardiac surgery, and you need to recover, get back to your normal life and routine, then in such cases, remedies would mean that you would have physiotherapy sessions with the cardiac rehabilitation unit or the nurse, and they would consist of a combination of medication, physiotherapy, and support that will be provided by the healthcare services for you to get back onto your feet. Now, when we talk about, because the word is health care and social care. So when we look at the budgeting within the NHS, you have budgeting which is done for healthcare, you have budgeting which is done for social care, and now you also have budgeting which is done for mental health care services. And that's why it's important to understand these three terms, because in the first assessment criteria, and sometimes we end up using them synonymously to say health and social care, but it is actually two different types of services. So healthcare and social care. So social care provision is basically social services that are provided by the Secretary of State or the Department of Health and Social Care to support people with different, say, for example, disabilities. Now, these disabilities could be learning disabilities, physical disabilities, long-term illnesses, or terminal illnesses in some cases, and also mental health illnesses. So people who have, say, for example, OCD or ADHD, or for example, feel more anxious and get stressed easily, then in those cases, they would be covered under the Mental Health Act, and they would involve what is called mental health care services provision. Now, social services is basically, I would say, an example of that would be within the NHS, National Health Service, you have a lot of people who work as health and social care workers. Now, the health and social care workers provide that support which is required for two people who have disabilities or some sort of disabilities essentially related to learning, physical, or because of the illness or the, say, for example, the operation or clinical procedure that they've gone with. Now, an example that I'll stick to here is if you had, say, for example, an open heart surgery, you'll have a bit of a rehabilitation within the CCU unit, critical care unit, or the ICU for a couple of days. Then you will be transferred to the critical care unit, and then you will be transferred to the CCCU, which is basically in which you would not need 24-hour supervision, but essentially you'll still be under supervision to check if you are, if your wounds are healing, for example, the stitches are healing, and the operation of the surgery which has happened essentially is making that difference in terms of you helping you to get back onto the recovery path. Now, once you're discharged from the hospital, you would still need those services or support services, and they would be given across to you from a point of view of social care provision. So some of the things which a patient would get discharged from the hospital would be asked is, do you live by yourself or do you live with your family? There would be a certain set of questions which the nurse or the head nurse would ask before discharge is done. They would also ask you what kind of house do you live in, what kind of facilities do you have, is it on the first floor, where is your bedroom, is it on the first floor or on the ground floor, and do you have people who come in and see you, and who cooks for you, and things like that. Now, the reason why this questioning, it is an elaborate questionnaire, but I'm just picking up a few questions. The reason why I'm saying this is that why do they ask these questions is because what the nurse is trying to do is put some support services in place for the patient who's going to be discharged from the hospital but would need support and care at their home for the next couple of days or weeks for them to get fully, fully recover or get better. So in such cases, for example, health and social care workers would be making periodic visits to look at medication, to look at bathing, to look at cleaning, to look at, for example, food and other services if the person is living alone. If the person is living in family, in some cases, what they would do is a person who's had a cardiac surgery would need a chair to sit upright, do some sort of exercises, maybe need a walking stick or some sort of a walking support. And those are bits which would be provided by the social care services unit in that particular area. And these services would be provided, and some of the equipment which is required would be delivered to your home, so that the patient is on the mend path and is able to recover fully after having that surgery. So the support that could be provided by social workers, the local council, the social care provisions unit in that area, they would be looking at covering practical activities, which could be involving, walking activities, physiotherapy sessions, personal care. And in such cases, people receiving that kind of care from social care workers or workers essentially from the social care unit in that area, sorry, they would be classed as what are called social care provision services. So in general, when we do talk about looking at the different types of services which primarily can be provided, in the under the National Health Service, and when we look at the structure of health and social care provision, you would need to differentiate between these types of services. One is healthcare provision, the other is social care provision, and now you also have mental health care provision, which is separate in terms of the services being provided under the National Health Service to the members of public. Okay, now let's look at a couple of other things related to this assessment criteria, and that would be what is promoting health and well-being in health and social care. So how do we look at mentioning that when we do say health and social care provision, what does it mean, and how does the government actually provide these services to the members of public? So when we say promoting health and social well-being, essentially what you're receiving is what is called a care plan. Sorry, a care plan. Now, a care plan is essentially a planning document which the people working within this sector would have, and they would develop this plan in coordination with or in conjunction with the family members, the medical team, and obviously there'll be clear responsibilities charted out in terms of what services are being provided by what members of staff within the hospital or within a particular setup to the patient. So in this case, when we do talk about well-being, well-being is a broad concept, and it is described in areas wherein you would need to look at the 6 C's of, when we talk about the person-centered approach, we look at the 6 C's. That means, you're looking at providing care, you're providing, there are these attributes of person-centered care, which I would say, would need to be looked at when you look at the concept of well-being. So you need to give respect to the patient, you need to have dignity and respect the dignity of the patient. You would need to look at picking up signs of abuse and neglect. You'd also be looking at having discussions with the family members of the patient. And in most cases, when we look at, the decision-making process, what you're going to be doing is making sure that all the information is provided to the patient, and the decision is ultimately taken by the patient, and that decision is something that you will respect. So when we look at essentially the concept of, health and well-being, what we are looking at is we are looking at promoting this particular involvement of the patient in the aspects of care that the patient needs, and ensuring that all the support is provided in relation to, some of the, let's say, some of the care which needs to be provided. And that is developed primarily, as a care plan. Now, one of the other things that we are looking at is when you look at person-centered care, this is something which probably you would have studied in Unit 2 and principal values, of health and social care. Here we are looking at essentially involving people in their own health and social care treatment. So you're looking at obviously giving them all the information. You're also empowering them with the process of getting that information so that it allows them to make a confident decision. You'd be looking at obviously respecting their dignity and their culture in the background. And in most cases, what you would essentially do is that in most cases, what you're going to do is make sure that you are able to provide all the information which allows the patient to make the decision. Now, some parts of this are important terms that we need to be able to look at, and these terms essentially, would give you a clarity when we talk about healthcare provision and when we talk about social services provision. Now, when we look at the system in general, what you're going to see is that the system in general would essentially allow you, to get these services irrespective of where you come from, what is your background, and what kind of services do you need. Now, this is something that needs to be looked at from a point of view of assessment. And this assessment, when we do allow this assessment, typically tends to be essentially allowing I would say this assessment allows essentially for, I would say, very detailed planning to be done. And this detailed planning allows the care which is being provided to the patient being tailored to ensure that the services that we need to provide or the staff in the NHS needs to provide is essentially being met. So when we look at a couple of key terms, you start off with health and social care provision, you talk about a person-centered approach, you talk about a care plan, and then you talk about the individual I would say requirements when these plans are put in place in order to ensure that the patient is able to get the required or requisite services from the National Health Service. So these care plans are implemented by the staff, members of staff. It could be a nurse, it could be a healthcare worker, it could be a social worker, it could be a doctor or a GP or a consultant within the hospital when you're receiving this care. And this is what is required to be understood in the first assessment criteria, which is looking at the key terms that you would come across when you talk about healthcare provision and when you talk about social care provision. Any questions on this? Okay. Now, let's go across to the second assessment criteria quite briefly, which talks about, describe the organization of health and social care provision within your chosen country. Now, initially, I brought this chart across, which primarily gives us an overview of what the organogram or the structure of the healthcare system in the UK is. Now, because we have devolved budgeting across 4 different nations, so we are going to be focused on services primarily within England. And when we do say services primarily within England, we would need to understand what is the structure of the system in a chosen country. So the chosen country is England, and what we are looking at is the current structure of healthcare system in England in particular to discuss this assessment criteria. Now, detailing of this system, can be done by looking at this particular organogram specifically in England. Now, what we're looking at is the Department of Health, which is on the top, then provides most of the budgeting to NHS England. And NHS England and the NHS Act of 2010, as an organization, looks at monitoring and ensuring that, this particular system is implemented evenly and without any, let's say, variations across the various trusts that we have and the clinical commissioning groups that we have across England. So here you would generally see that the hospitals and various departments which are within hospitals would be formed under what is called clinical commissioning group or CCGs. There are 209 of them in England. Then you would further break that down into GP surgeries, dentist surgeries, pharmacies, and things like that. And then you will have services which are provided under the National Health Service banner. But these services could be mental health services, community services, ambulance and emergency services. And there are 251 of them within England. And then you have partnership with private providers of health. You have, say, for example, Spiral, you have Bupa, some of the big organizations which have branches in different locations, including Manchester, Leeds, London, Birmingham. And then you have social care providers which work in tandem with the NHS, and these providers actually help in the doling out of day-to-day activities and services which are covered under what are called social care services. And social care providers would be care agencies which work with the NHS to provide these services to the members of public when it comes to, say, for example, tertiary care or specialist care, which is required under tertiary care. Now, these agencies are under the direct supervision of the local authority, which is primarily our councils, and they would, if they need to derive any funding, they would essentially come from the local authority. Now, this is how the structure of the NHS in England would essentially entail out. And who are the members of staff which essentially provide these services? You have, I don't know whether you looked at this website, but there is a website in the NHS which is called NHS Careers, and there are 350 different types of careers or different types of roles which people can actually do within the NHS. Now, I would suggest, I'll put this link down here on the slide, and I would suggest that in terms, and I'll show you this very briefly. So in terms of understanding what are the different kind of professionals which work within the NHS to provide the health and social care provision to the members of public, this website gives you a very good idea in terms of exploring those roles. There are 350 different careers, and there are, or I would put it this way, literally, there are 350 different types of roles which could be involved in providing out these services to the members of public. So you click on this red tab, which is Explore Roles, and these are the different roles that you could work under when we say you're working within the health and social care provision within England. So you have allied healthcare professionals. You can further look at different types of roles and an overview: ambulance services team, dental teams, doctors. You have estate and facilities, health informatics, healthcare science, healthcare support workers. You have management or practice managers. You have medical associate professions, midwifery, nursing, pharmacy, psychological professions, public health, and wider healthcare team. So if I were to expand any of these, these are the various kind of roles, and they all add up to 350 different roles that you would generally see under the organization of health and social care provision in a particular country. So within England, these kind of roles would be available, under, say, for example, psychological professions. So when I talk about a physiotherapist, it would be one of these roles which essentially would be allied healthcare professionals, and they would be covered here. So when you go and have an X-ray, when you go and have an MRI, you, for example, visit a dietitian clinic, if you had a heart surgery or you want to reduce your cholesterol, these are the various kind of specialist people who work within that particular department, and they would be responsible for providing services. Now, if I take you back to the structure, and you'd be able to relate to it, that these are these, now here it's difficult to show, but these kind of roles would fall under these kind of categories under the Department of Health and the NHS England, and that would mean that you would have a very good grasp and an understanding of, the organization of health and social care sector within England in particular. Any questions on this? So I've got a few slides that you can go through, which will provide you some bit of understanding in terms of what the structure is and how that structure essentially works. It's a bit of reading that you would need to do, and that would give you that understanding. Now, apart from the roles, what is it that we want to understand under the health and social care provision? So if I look at the first organogram which I had shown, which is this one, and you looked at the outer circle, which talked about Parliament, the acts and the legislation, these are the key acts and legislations that we need to be aware of as far as health and social care provision is concerned. So we need to be aware of the Health and Social Care Act, the Equalities Act, the Social Value Act, some of the acts which are important when we do work within the sector. Say, if I work as a nurse, as a doctor, as a professional, or as a physiotherapist, I need to be aware of some of these acts and legislations, and I would get, if I'm not aware, then I would be put under some sort of a training to get myself acquainted with these acts, because they are required to be used, implemented at my point of contact or my point of working when I'm working within this sector. So Health and Safety Act, the COSH Act, the RIDOR Act, the Regulatory Fire Reform Act, these are the various acts that I need to be aware of when I'm working within this sector, because I would use these as policies, as procedures to be able to effectively deliver my services to the members of public. So I need to put public out of the harm's way. As a doctor, as a GP, as a practice manager, I need to ensure that the services or the premises in which the patients come in and see the GP is safe and secure. It's not falling down, or it's not posing any sort of a risk to the members of public. And that is where the Health and Safety Act or HASWA, as we call it, HASWA Act of 1974 comes in place. So this is the bit that you would need to understand primarily when we do talk about, the assessment criteria 1.2. Any questions on this so far? Any questions?
No.
Yes. Okay.
Oh, okay.
Any questions? Yeah, feel free to ask, no problem.
You say something regarding the health and social care,
Yes.
and then I want to ask, there are some clinical, or let me say complex care, in the sense that the person is 100% capacity. However, due to, let's say, spinal cord injury or something, so it needs care. So I want to ask, what category can we categorize those set of
So
carers?
essentially, initial care that you will get would be under what is called secondary care, because you would have had or undergone a surgery. Now, once that surgery has happened, you need to obviously, there is a rehabilitation time or a recovery time for that surgery. And after that, the care that you would need would be when you get discharged from the hospital, you would need what is called tertiary care. And that would be classed under secondary and tertiary care. So if the moment we think of any sort of a surgery that you would need, or you undergo an operation, or if you had an accident, it will not include primary care. It will always include secondary care, because you'll need to go into the hospital or to see a specialist or a consultant to get diagnosis, and obviously in some cases treatment for that particular, say treatment for that particular disease or the condition. Now, once you've had the treatment, you can't indefinitely stay at the hospital. From there, you at some point in time would be discharged. I know that people, for example, when they have certain types of surgeries, they can also lead or have what are called negative effects. So the surgery might not go as planned, and you might have complications. So in such cases, you might be still in the hospital. Your stay in the hospital might need supervision and care. You would be, unless you're out of the harm's way and you're on the path of recovery, you would not be discharged from the hospital. But at some stage, assuming the person is discharged, they would then need what is called tertiary care, because as I gave an example of heart surgery, somebody who's had an open bypass or some sort of a bypass surgery, it cannot mean that you would basically have, I'm not talking about stenting or angioplasty. I'm talking about, for example, a surgery or a bypass surgery, wherein you have to cut the chest, you have to do a bypass of the artery. It's a major surgery which happens. And in such cases, the patients require, a recovery period of 6 to 8 weeks. So in such cases, it will be classified as tertiary care once you've discharged from the hospital. And that would mean you have physiotherapy sessions, you have medical or cardiac nurses visiting you at home to be able to check on you. Your medication will undergo a review in 6 to 8 weeks after you had the initial medication and you are essentially recovering. There'll be checks on infection, your bloods, a lot of other things which will happen, and that will all be involved in what is called tertiary care. Now, some part of it would happen at the hospital, some part of it would be when you get discharged, would happen at your home. And in such cases, what you will generally see is that there'll be a combination of different types of staff or workers within health and social care, which will be visiting you to ensure that you are able to get back onto your feet and recover fully from that particular surgery. Is that okay? Does that answer your question?
Yeah, thank you.
Okay, no worries. Now, the next assessment criteria that we have is 1.3, which talks about describing the size of health and social care sector within your chosen country. So here, I would look at restricting myself to UK in particular. And when we do talk about just within the UK, NHS England, that is what I'm going to concentrate on. Now, we had the first Labour budget after so many years yesterday, and I think the NHS funding has been increased, but when we look at the overall funding which the National Health Service gets, because we're looking at the size and of funding or in terms of finance which this particular sector gets. So the size of funding in the NHS is about 122 billion. Now 65 billion of that actually comes into, I would say 65% of that actually comes into England in particular. Now, when we look at this funding, slightly outdated figures in the slide, but when we look at the funding which was done in terms of announcements yesterday, the Chancellor is looking at finding budgets or areas from which it can redeploy this budget. I think Rachel Reeves has increased that budget by 22 billion, but also has put an onus on the NHS that the money has to, the increased budgeting which is being provided to NHS would mean that the services would also need to be at par, and customers would need to get value for money for these services that would come in from the increased budgeting which is happening in the NHS. So if I were to put it this way, from the best of my knowledge, 1/5 of our budgeting or finances in the UK typically goes into the NHS. You have some part of it going into funding for the army and the armed forces, and you have lots of other different types of services, public sector services like infrastructure and other bits. But NHS typically gets 1/5 or 1/6 of the budgeting when the Chancellor announces a budget every year. So in terms of the size and scale, I look at one as finance. Then when we look at number of people working within the NHS, NHS is the largest employer of people in the public sector in the UK. So there are over 155,000 professionals. When I say professionals, across those 350 careers, which I give you the website link of, actually work within the UK. And these are people who are directly involved and directly employed by the National Health Service, whether it's in England, Wales, Northern Ireland, or Scotland. And then on top of it, you have another 1.2 million people which are essentially employed in ancillary services, which could be care agencies, local authorities, public-private partnership agencies, and they would be also looking at providing services in tandem with the NHS. So when we do talk about size, we have to put this into context in terms of finances, in terms of number of people which work within this particular sector. And this was the last particular chart that we had when obviously we updated it, was that when you look at the scale of the budget and what part of the GDP it constitutes within the UK, when we talk about the National Health Service budget, you can see that the NHS budget is almost 1/5 of the provision of some of the main services that are essentially provided or funded by the government. So when we talk about the gross domestic product, which is the total revenue or a turnover of the country, so UK's turnover, or if I combine all the output and turnover of businesses in the UK, private, public sector, all combined, it's 2.9 trillion. So when we look at the division of this, turnover across and how much of it is funded by the government in particular, we look at this from a point of view of budgeting, which the government does as far as the National Health Service is concerned. And when we look at that, we look at this, being 10.2% of the GDP. So literally, it's not 1/5, but it's probably say 1/10 of the GDP of UK. But within that, what we also look at is when this 10% of this budget is 2.9 trillion. If you look at 10% of that, that is 209 billion pounds is essentially pumped into the NHS. If I look at this year's figures, now, if I look at that 209 billion pounds, how much of it is going into what type of services within the NHS is actually shown on this particular chart and the graph. So in this particular part, what we need to be able to do in this assessment criteria is understand the aspects of where the scale and the size of the National Health Service is. And in terms of size and structure, we look at the NHS Foundation, we look at social care services, we look at the investment which goes into research, which NHS puts in, like, for example, with different charities like the Christie for cancer research, British Heart Foundation, for cardiac diseases research. We look at the pay structure of the workforce, last year or last year when we had striking nurses and doctors and things like that, the government agreed to give a 10% or a 12% pay rise across 2 years, because there was a freeze on the public sector pay for the last 3 years after COVID. So this was agreed. And obviously, what are the areas in which the NHS is looking at growing, and what are the challenges, or what are the further areas in which NHS actually spends money? One such thing that you would look at is primarily the IT systems which were put in place. And I think the implementation of the IT system, which was done a couple of years back, costed 1.2 billion to the NHS in terms of ensuring that data of patients is available across all the providers, whether it's surgeries, hospitals, and if you have your NHS number and you have your my MFT login, you're able to put your NHS number in, your date of birth in, and you're able to get reports and all such forms of data that you need without having to contact your surgery. And that is being made possible because there has been budget deployed and a centralized IT system created across the National Health Service. And that would be something that we would need to understand when we talk about the size of health and social care sector in your chosen country, which is England. Now, further provisions in terms of sizing could be done in terms of how much does the UK government spend on per person on healthcare. And that figure as of 2017 was 2989. If I look at the UK healthcare spending per person is the second lowest in the developed countries when we look at France, Germany, and United States. Obviously, in the US, this part of it is actually funded through insurance, which was the Obama Act or Obamacare Act, which was created by President Obama, I think in his second term. And when we look at sometimes referring to this particular statement of that there's a gaping hole in the NHS and there's a gaping hole in this, that means that sometimes public sector organizations also fall short of funding, and the government is not able to provide adequate funding to be able to fund those services. So in such cases, when we look at the government increasing the budgeting for the NHS, is to primarily help cope with the rising costs that is also propping up in the National Health Service, because there is more population, for example, requiring services now. And in such cases, in order to provide services to each and every member of the public, there is funding being increased in the National Health Service, and that would also relate to size and structure of the size and structure of the health and social care sector. And that is why one of the things that you would get to see that in the UK, you would see that every successive government looks at talking about the National Health Service, increasing the funding, building more hospitals, and obviously reducing the wait times in A&E. And these are all important statistics which are looked at by the Department of Health, so that the members of public are able to get services on time, and wait times for some of these services could be reduced. One of the things you would have also heard and seen a number of times mentioned across news is that if I need to see my GP, I need to wait for days and days to be able to see my GP. And the government is now making it very clear that a patient should be able to see a GP, when they do need to see a GP. And most surgeries look at, when they look at GPs working on certain days, they look at aiming to, at least see 70 to 75 patients in the surgery, so that the wait times that we get to see and hear, and a lot of complaints about it against the NHS are, being currently worked on by the practice managers and obviously management within the NHS Foundation to ensure that, there are services that we can provide online. There are services that we can give information on through the online route, but there are places in which the patients actually need to meet the GP or see the GP, and that is why it cannot be replaced. And these wait times are currently being reduced by employing standard procedures and changes in the structure in terms of how these services are provided to the members of public. Any questions on this so far? Okay. The next assessment criteria, very briefly, the first learning outcome is slightly longer, so a bit more time is required to cover it. What I want to do is not rush it through, but cover it in thorough detail. So when we look at the criteria, which is the last one in the past one, 1.4, it talks about explain how health and social care provision is funded within your chosen country. So chosen country is England. health and social care provision, we look at the National Health Service. Now, this is funded through when we look at state funding, we look at national health insurance contributions, or NIs as I call it. And some part of that under general taxation is used by the government to fund the NHS. That is what you need to look at. Then some part of it is also funded through private health insurance. A lot of us who are economically well off may have private health insurance, and in such cases, those private health insurance policies would cover, some of your private health care, which could be provided by various private providers like Bupa or, for example, Spiral, or you have Alexandra, and some of these are, big trusts and chains which are present across multiple cities in the UK. The third form of funding that you would look at would be funding which comes in, primarily from the government to the national service as a whole. And when we do talk about these funding, they come across primarily from the government. So when I talk about 209 billion in terms of funding, or 10.2% of the GDP, that is the amount of fund which the government provides to all the national health services, whether it's rolled out in England, Wales, Scotland, or Northern Ireland. And that fund is divided depending on the number of population and the trusts and the clinical commissioning groups which are present across various devolved nations. Now, some part of this funding can also come from charities. So when you look at Christie's, Macmillan, you look at all these various other organizations which are essentially charities which work very closely with the NHS, they get funding because these charities are able to raise money through the members of public. And in such cases, these charities essentially also, because they're working and offering services on behalf of the National Health Service, are also able to get some funding primarily from the government. And that would be the third way in which how the health and social care provision is funded within England and Wales. Then we also look at a majority of this funding coming across from local authority funding, which is primarily the council tax that you pay. So I don't know how many of you have ever looked at your council tax bill, but if you look at the council tax bill and the breakup of that bill, you generally see that that particular, bill, let me try and bring something across as a chart. What I want to show you is, so if you have looked at the council tax bill and where does your council, the bill that you pay, say, for example, I pay about roughly, I think, £280 or something like that, because there are different bands from A to F. And if you're in one of those bands and you pay up a bit of council tax every month, you would need to know where is the council tax being invested, what that money that is essentially paid by you, how is that money essentially invested by the local council into various services that it provides back in terms of the members to the members of public. So when I look at the breakup, I'm going to try and bring this bit in terms of how does the Manchester Council. So let me just bring this out as an image, which might be easier for us to understand. So let's put it this way. So just randomly picked up a particular figure. So when I say that we have one form of funding which comes from the local authority, this is, for example, Stockport Council, which essentially receives council tax from the member of public. So for example, if the population of Stockport is 1.5, 1.6 million people, and some of them are eligible to pay exempt from council tax because they retire or whatever, but other people who pay council tax, and this is the annual revenue that it generates, it is using out of that revenue 58.2 million for children and education services, 124 million for adult social care services, 17 million for public health services, 52 million for cultural and environmental planning services, which is your recycling of waste and other bits, then for transport, road and highways, and then central services and financing costs. So if I look at in general, one areas through which funding comes for the health and social care provision in your country, in, say, for example, England, part of it, as you can see, comes from local authority funding, which will be council tax bills that we pay as members of public. And part of it, as you can see, 17 million is going to public health, 124 million into social care, and then children education services would be schools, sixth form colleges, and things like that. So you need to be aware. And I think one of the things which I would ask you to do as a bit of a homework or a task would be to look at your council tax bill for this year, 23 or 24, 25, and see what part of that bill actually goes into funding the health and social care services that you get in your area or in the area that you're living. So any questions on this so far? So funding can come from public funding, from national insurance contributions, from charities. You have local authorities funding. You have private funding, which can come into organizations primarily for the purposes of research. And then there could be funding which the government provides on an ad hoc basis on certain, say for example, important areas like COVID. There was a lot of ad hoc funding provided by the government to fund, vaccination drive, across the country. And in such cases, there would be exigency funds which the government would have. And in such cases, those would all be looking at providing funding towards the health and social care provision in your chosen country. Any questions on this so far? Right. Okay. So the next assessment criteria that we want to quickly look at is outline the sector is who is regulating the sector as far as the National Health Service is concerned. Now, there are lots of different regulators and agencies, but in general, we'll talk about 2 or 3 in particular. So because this sector enjoys a lot of government funds, which is funds or money paid by the taxpayer, it also needs to be held accountable for providing those services, the quality of services which are required. That means if I need to get care and if I don't get it on time and it leads to death or bereavement, then in such cases, what is that of any use to any member of the public? So in such cases, there are regulators which essentially do inspections, monitoring, ensuring that the guidelines and legislation and acts are clearly implemented and they are adhering to providing the top quality service which is a part of the NHS constitution is being provided to the members of public. So one such organization that we look at is the CQC, which is Care Quality Commission. Now, this was established in 2009. It's a primary regulator of health and social care services in England. It inspects and monitors hospitals, any sort of a NHS setup, and ensures that they meet the fundamental standards of quality and safety. Now, the CQC also publishes these reports on its website and ratings, and this is to inform the members of public that what is the quality of service which this particular setup delivers as against what has been prescribed in the NHS constitution, or for example, in the in terms of policies and procedures. So this is a very important regulator. You want to open a care agency, you would need a license from CQC, inspection would be done, and you would need to conform to most of the regulatory requirements which it specifies for the purposes of ensuring that quality services are delivered to the members of public. Now, you can go into a lot of details for CQC, but essentially it has lots of, I would say, policies which you need to look at, and the policies focus on improving the provision of health and social care services. It can withdraw funding from a particular body because if it finds that the services have fallen below a particular standard, it can withdraw that funding straight away, from that body. It can put it under sanctions. It can ask it to close down. And in such cases, even criminal investigations can be started off if it finds that there have been, serious overlapping or serious, I would say, let me use the right word. There have been serious breaches of certain policies and procedures which it prescribes, and they have not been done in that particular setup. Now, there are other regulatory bodies. These are all what are called chartered bodies. So there are 19 of them that you need to be aware of. So when I talk about, for example, GMC, which is Journal Medical Council, which is a council of, basically a council which regulates doctors or GPs. So if you want to do a private practice in the UK, you would need a GMC license, and that license would be provided, to you or your setup that you would create. So, for example, if you want to do a private practice in the UK, you would need that license. You would need to conform to some of the guidelines which the GMC prescribes. And once those guidelines are met, then you are going to be given a license to be able to run your own surgery or, for example, run your own practice. Now, there are lots of them. You have dental council, chiropractic council, you have the osteopathic, optical council, nursing and midwifery council. Some of the ones that we are aware of, which we get to hear in the news, GMC, NMC, they are quite, and the Healthcare Professional Council, HCPC. These are the ones which are quite important because I'm saying all of them are important, but these are the ones which are bits that we have heard about in the news or read about in the newspaper or articles. And those are the ones that you need to be aware of. So when you look at this assessment criteria, it is asking you to outline how this sector is regulated, and you might need to choose a few of these to detail them out. I would not say you cover all the 18, 19 of them, but use the ones that you think you would need to do a bit of research by going onto their websites, and then areas in which either you work in or you're aware of, and those could be brought across in your assignment at a later stage. So I provided a bit of an outline or a brief in terms of the main important ones that we know are regulators. CQC is one of them, GMC, NMC, Nursing and Midwifery Council, and they are the ones that I would suggest that you need to be aware of. Now, in terms of legislations, there are lots of them. And we covered the Health and Social Care Act, the CARE Act of 2014, the Mental Health Care Act, the Children's Act, and those could also be brought across in this particular criteria. Now, the last one, which is the distinction criteria, talks about analyzing the health and social care spending for a chosen country. So this one is associated with the assessment criteria 1.3, which is what we've covered, primarily talking about the size and scale of the, the sector, health and social care sector in England. And this is where it needs a bit more detailing to be able to achieve distinction. So what I would suggest in this case is, for example, if you choose England, what I would do is in England, obviously, health and social care spending is a very critical area of public finance. So when I look at the spending across the budget, which the NHS England gets, it spends about 12.8% on incapacity benefits. There are benefits for carers, there are disability benefits, and then there is local authority and health and social care benefits, which it spends money on. So when I look at the analysis of the aspects of health and social care funding, the overall spending exceeds 209 billion as we know it today. Now, out of this, when we look at social care spending is about 20 billion or 16.8 extrapolated because these figures are 2021. If I look at in today's context of 2024, they will be in the region of about 20 billion. Now, with funding coming across from public funding, private funding, charities, and also semi-government organizations for research purposes, what you're going to see is that this spending has to be broken down into 3 different forms of care that we are looking at: primary, secondary, and tertiary. And when we look at further breaking it down into different provisions, whether it's healthcare provision, social care provision, and mental health care provision, and in some cases, preventive services, you would be looking at dividing that budget across by presenting to say, by using different charts. These charts are charts which I've taken from the King's Fund, from the OECD office, the Office of National Statistics, ONS, and also from the NHS website. So what you would need to do for distinction is to do a bit of research and, put across various arguments in terms of charts, I would say tables, to show how is this spending broken up, or what is the budget which the NHS England gets, for example, and then how is this spending broken up to understand what part of it provides what funding to which part of these services, whether healthcare provision, mental health care provision, social health care provision, or primary, secondary, or tertiary, care provision. So when we look at the funding that is generally available, a part of it, you might take an example of COVID, for example. In COVID, there was a lot of funding which was diverted towards vaccination, making up makeshift hospitals, for example, which were created in Birmingham and London and Manchester in order to look at patients being admitted because of breathing difficulties. And that could be an area that you could use as an example to show how the spending of budget happens within the health and social care sector specifically to England. Is that okay? Any questions on this so far? So this brings us to the end. Obviously, I've put some examples of COVID as a pandemic, obviously, and there was funding diverted from the usual funding that would go across to the NHS, and that could be used as an example if you want to do so in terms of explaining this distinction criteria. But that would be looking at bringing this particular session to an end, because this would allow us to cover comprehensively, the assessment criteria is 1.1 to 1.4, and looking at the merit and distinction criteria. Now, from my point of view, if I quickly show you the Moodle, which I also want to do as a part of the first session in this unit, is to also draw your attention towards, what is available in terms of Moodle for the purposes of study. So if I just share my screen right now, so that you're able to see, this is the Moodle. Most of you should have access to it or who are on the course. When you log in, you're able to go into ATHE and look at the Level 3 Diploma in Health and Social Care 2023. You can collapse first all the units. What we are focused on is Unit 1. Click on the left-hand arrow and it'll open that unit up. There are obviously some lecture recordings for the previous lectures which have been delivered by some of my colleagues. You'll be able to see the presentation, which are essentially a part of these lectures. Obviously, the new lectures will replace the older ones on Moodle. This is the presentation that I've used today for our discussion, and you should be able to get access to this, and a new copy of the recording of today's lecture would actually come up here under LO1. Now, the other bits that I would want you to look at in terms of the Moodle would be, after the session is over, I'd be uploading a couple of documents here. And these couple of documents that I'm going to upload, I will show them to you very briefly. These documents are for some additional reading. The reason I say this is that you would be finding them useful for the purposes of studying and knowing about the health and social care sector and its provision that we have covered in Learning Outcome 1. Now, this one particular document, which is specific to Learning Outcome 1, I have used this document to create the presentation and also for my lecture. This would give you a very detailed idea about the structure of National Health Service in England. So this is a document downloaded from the House of Commons library. It is an 86-page or 83-page document, but what it would cover is all the assessment criteria that we have discussed today in terms of the structure of the NHS, the structure of the health and social care provision, the funding part of it, the size and structure and funding part of it, and also giving you a bit of a direction in terms of what are the reforms which have happened in the NHS after 75 years of establishment, and then what are the various departments that we talked about, the PCCTs, the CCGs, the surgeries, and the community care. All that has been very clearly defined in this particular document. For those of you who are working within this sector and have no knowledge of the NHS, this is like a Bible. I would suggest every page has to be read, and this would give you the detailed knowledge and information with regards to not just knowing about the health and social care services in the UK and the department, but would also be very useful for you to get some background knowledge when you're from a place of your understanding and also your place of working that you are currently doing if you're working within the NHS. So this document is going to be available on Moodle under the Learning Outcome 1 presentation. And that would mean that you should be able to access this to read this document, and will also come in quite handy specifically at a later stage when you are, I would say, doing your assignment, because you won't need to go out and fish for data in different locations or look for data at Google. But this document would be subtly useful because it provides all the information that you need and that we have covered in our presentation today. So now this document is up on Moodle. For those of you who want to log in and see, should be able to get hold of this particular document, which is called the Structure of the NHS England. And it is a document that I would suggest that you read, before we have the next session on Wednesday. So just to show you where this document is, very briefly, there we go. So I've uploaded that document here, which is just towards the end of the presentations, but I will ask Andy to move it up to just under the Learning One outcome presentation shortly. So I hope you've enjoyed the lecture today, and it has hopefully given you some information in detail. And I would look forward to obviously, seeing you next week on Wednesday. We couldn't start because we had a couple of our learners starting with us today, and I'm glad that they've been able to join this session. So if you think of any questions, we do a bit of a quick recap when we do our Learning Outcome 2 next week on Wednesday. Feel free to write those questions down, email them across, or feel free to ask them, and we will, catch up with them next week. Any other, thoughts from anybody else on the session today? Okay.
No.
Okay, great. Good stuff. So what I'm going to do is bring this session to an end, and hopefully we'll catch up with you on Wednesday to discuss Learning Outcome 2. Thank you so much for joining.
Thank you.
Thank you.
Bye.
Thank you. Take care. Bye. Bye for now.